Hello, everybody. My name is Carmela DeLuca, and I am the chair of the Young Women in Bio program in Montreal. I'm really excited today. We have some really interesting presentations from some really interested and committed girls that are going to be talking about COVID in Montreal and some of the research and some of the programs that are going on here in Montreal. The Young Women in Bio program, since COVID, has had to go online, but we've been very lucky to still have participation from some really interesting girls. So with that as an introduction, I'm going to start with the presentations. The first person that we're going to be hearing from today is Jasmine Peltier. She's going to be talking a little bit about the eating habits during COVID, so I'm going to turn it over to her.
Hi, my name is Jasmine Peltier. I'm a graduating student at Collège Montreal, and my part of the project is called Eating Habits and Diabetes Management during the COVID-19 pandemic. So, the person that I interviewed is named Dr. Anne-Sophie Brazeau, who is an assistant professor and program director of dietetic education and practice in the School of Human Nutrition in the Faculty of Agricultural and Environmental Sciences at McGill University. She is a registered dietitian and a member of the Ordre professionnel des diététistes du Québec, OPDQ. She's a lead in the COVID diet study and a study on the experiences of people with type 1 diabetes during the pandemic, which is part of a larger project called the Better Project. So the people working on the study, other than Dr. Brazeau, are Stéphanie Chevalier, Anne-Julie Tessier, Audrey Moyen, Claire Lawson, Chloé Florent Grégoire, Aviva Rapaport, Sophie Lalonde-Bester, and Kristen Sundstrom. The purpose of COVID Diet is to inform public health agencies of the eating habits of Canadians during the pandemic for future economic crises and isolation measures. They are trying to see if eating habits have changed for better or for worse. The quality of people's meals depends on social economic status. It has been difficult for them to recruit some participants from certain groups, for example, people who use food banks. There are two components to the study. First is an online component, and the second is an app called Quinoa. The online component, their questionnaire, has been completed 800 times so far. The Quinoa app component involves looking at pictures of the food people have eaten. So far, 400 people have completed the first stage. They will be recontacting them in 3 months to complete the second stage. They have started to analyze the data they collected thus far. According to the data, alcohol consumption has increased since the pandemic. So far, 1,200 people have registered. They are hoping for at least 2,000 people to participate. 800 people in Quebec have completed the questionnaire. They are also receiving input from other provinces. The next phase will be looking at Ontario and Indigenous communities. The Better Project enlists people living with type 1 diabetes in Quebec with the purpose of measuring the frequency and severity of hypoglycemic episodes. In other words, it's a registry to get more information on the risks of living with diabetes, such as low blood sugar. Dr. Brazeau is working on the COVID aspect of the project, which entails collecting information on how people with type 1 diabetes and their families have been managing their diabetes during the pandemic. The project has two surveys. There are open-ended questions and closed-ended questions. The questions include looking at the impact of COVID on diabetes management and mental health. 1,000 people are in the registry so far, and 400 people with type 1 diabetes have completed the COVID questionnaire. The data they have is based on a narrow window, and so the impacts may be easier to discern. Overall, most patients have had a good experience. Only one patient in the cohort has had COVID. However, there have been some issues. Some of the issues that have been reported are related to stress. For example, people are worried about their access to insulin and supplies and whether others have been washing their hands. A significant number of people have had depression. They will be following up to see if that depression continued. A third of the patients said their blood sugar levels were higher, and this is perhaps because they are moving less due to the quarantine. Thank you so much for listening, and thank you to Dr. Brazeau for letting me interview her.
That was fantastic. That was really interesting. Thank you so much, Jasmine. I think Tunda now is going to introduce herself. I'm lucky to have a great committee of people who help me run the YWIB program. Tunda?
Thank you, Carmela. Yes, my name is Tunda Golanar, and I'm a fifth-year PhD student at the Goodman Cancer Center, and I work on lung cancer research, and I have joined Women in Bio a little bit more than a year ago now. And I think, should I ask my question to Jasmine? Or...
Sure, go ahead. Sure.
Okay, because I was very interested that have your eating habits changed during the lockdown?
They have. I have been eating way healthier because I can't go to restaurants. And so I've been making my own bread, my own food, my own meals, eating with my family. And yeah, we've all been eating way healthier.
That's amazing. That sounds great. So now I would introduce our next speaker, Zoe, and she is going to talk about how hospitals have changed measures to protect the workers, doctors, and nurses.
Zoe, did you want to introduce yourself? Oh, we'll go straight to your presentation. Great.
So yeah, I'm going to be talking about how hospitals, specifically the MUHC hospital centers, have kept patients and staff safe during the pandemic. So I'm going to start by going through a timeline of COVID in the city of Montreal. On February 28th, Montreal saw its first presumed COVID case, a woman coming home from a trip to Iran. Already a month later, on March 27th, the city was up to almost 1,000 cases, and Mayor Plante declared a state of health emergency. Jump a month forward, April 23rd, and the cases in Montreal went up tenfold. During the early months of the pandemic, Quebec's care homes were hit particularly hard, and the province was under a lot of scrutiny from the country, who thought Quebec wasn't taking the necessary measures to keep people safe. Now, September 2020, there have been almost 30,000 confirmed cases in the city and about 3,500 COVID-related deaths. We are by far the worst affected region in the country, and we account for 40% of the deaths in Canada. All this terrifying information begs the question: how are Montreal hospitals keeping things together amid this global pandemic? So the city has two major healthcare networks, the MUHC, or the McGill University Healthcare Center, and CHUM, or the Centre Hospitalier de l'Université de Montréal. In this presentation, I will specifically be talking about the MUHC. This care network is composed of 5 sites: the Glen site, Lachine Hospital, the Montreal General Hospital, the Neuro, and the MUHC Reproductive Center. First, to get an understanding of how the hospitals were affected by COVID, let's look at a timeline of important COVID-related events at the MUHC. On March 12th, the MUHC saw its first COVID case. A few weeks later, the care network was declared a designated COVID hospitalization center with 156 ICU beds and over 3,000 available nurses. From what I could gather, the MUHC has seen 2 minor hospital outbreaks, both on the 15th floor of the Montreal General Hospital. On April 14th, 6 patients and 10 healthcare workers were tested positive for the virus, and on May 26th, 6 patients and 1 healthcare worker was tested positive. Now, you may be asking yourself whether or not it's even safe to go to the hospital at the moment. Well, rest assured that the health and safety of patients and staff is the #1 priority of the MUHC. Since the beginning of the pandemic, safety measures were put in place for the public. Mask wearing, hand washing, and social distancing are mandatory at all sites. Hospital entrances have also been restricted. There are checkpoints for symptom screening and physical barriers throughout the hospital, and emergency rooms have increased the space between stretchers to limit the possibility of nosocomial infections. Furthermore, in the emergency room, all patients are administered a COVID test before being admitted to hospital. In regards to appointments, all medical imaging consultations, so like x-rays for example, have been rescheduled and virtual meetings have been arranged via Zoom, Télésanté, or React. Finally, all patients can only have 4 registered visitors and only 1 to 2 may visit at a time, depending on the type of patient and severity of the diagnosis. Of course, the visitors must have stayed within the country for 2 weeks and they may present no symptoms. While researching for this project, I had the pleasure of interviewing Tracy Cordiero. She is an amazing nurse who has been working at the Montreal Children's Hospital for 2 years. And yes, she has worked on the COVID ward with positive pediatric patients. I found out that at the moment, there are no COVID cases in the hospital. I also learned that most kids actually came to the hospital for a separate and unrelated medical concern. These asymptomatic children were diagnosed with COVID as a result of the swab test. These children can be discharged from the hospital to self-isolate once they are treated for their pre-existing condition. Here's what I learned about the COVID ward. It was opened around late March and is located on the 9th floor of the South Pod. At the beginning of the pandemic, some children had to be transferred to St. Justine Hospital. The ward consists of both COVID-positive patients and also rule-out patients. The ward originally had 12 negative pressure rooms, but unfortunately only 5 function now. So if you don't know what a negative pressure room is, don't feel bad, neither did I. Tracy informed me that a negative pressure room is an isolation room where the pressure inside is lower than the pressure outside. When the hospital room doors are opened, clean air flows into the room and contaminated air is prevented from escaping and infecting the rest of the hospital. The dangerous air is sucked out of the room with an exhaust system that filters the air before it is allowed to circulate throughout the rest of the hospital. To finish off my presentation, let's finally talk about how the hospital staff working on the ward are protected against COVID. Of course, healthcare professionals working with COVID patients need to be decked out in personal protective equipment. I'm talking masks, visors, gloves, reusable gowns, and hospital-provided scrubs. As you can imagine, the ward itself is also built around limiting the spread of airborne particulates. Each room is pressure controlled and has an antechamber. Furthermore, if a nurse is working on the South Pod, they can't leave the ward at any point during their shift, not for lunch breaks, not for bathroom breaks, at no time at all. Tracy said she thinks that it's possible that the hospital will permanently adopt some safety measures introduced during COVID, like a new and improved cleaning regimen for medical equipment and the rooms. So I was curious, do nurses working with COVID patients need to be tested more than the rest of us? Interestingly, nurses are only tested for COVID if they present symptoms. The nurse must then self-isolate until he or she gets back the test results. If the nurse is COVID positive, they must self-isolate for an additional 14 days. That information begged the question, as an essential worker, does Tracy feel safe working in a hospital during this time? The answer I got actually surprised me. Tracy says she felt safer working at a hospital than hypothetically working at a grocery store. Though at first I was surprised by that answer, her explanation made sense. At a grocery store, anyone you run into can potentially have COVID, so you must always proceed with caution during any interaction. However, at a hospital, everyone has been tested. You know exactly which patient has COVID and are then able to assess the risks and take all the necessary precautions. In summary, Nurse Tracy felt like the hospital had taken the measures necessary to keep herself, her colleagues, and her patients safe. That's it for me. A big thank you to Tracy, if she's watching this, for taking the time to sit down with me and inform young women in biology about this very important subject.
Wow, Zoe, that was fantastic. That was really very informative, and it's very comforting to know that we're in good hands in the hospitals, because if you're going to a hospital, you definitely don't want to have to worry about getting something else. Fantastic. Tenda, did you have any questions for Zoe?
Yes, I was wondering, did you find it enough that the measures they have taken? Do you think
Did they make you feel comfortable?
Yeah, so I definitely think that the hospitals have really thought of everything in terms of keeping patients and especially staff safe. So just the hospital scrubs, they are all provided by the hospital for people working on the COVID ward, and they're also washed at the hospital. I just think that the measures taken for also cleaning equipment, cleaning rooms have all been amped up. So they're really making sure that everyone is kept safe at this time.
That's fantastic. Yeah, it really makes me feel safer a little bit. Yeah.
Tunda, are you going to introduce our next speaker?
Yes. Um, so our next speaker will be, yes. So I would like to introduce Christina.
Christina Alaki, yes.
Yes, Christina Alaki, who is going to talk about the prevention that was taken by schools and also comparing these preventions between Quebec and Ontario.
Hi, my name is Christina Lackey, and I'm a fourth year student at Collège des Dames. And today I'm going to be talking to you about the prevention at schools in Quebec, and I'm also going to be comparing Quebec's prevention plan with that of Ontario. Can I have my first slide, please?
Absolutely. Unfortunately, Christina's video is not working today, so we'll be listening to Christina, and I will just put it on. There we go.
To begin, the prevention at schools in Quebec, we are everyone in the building is obligated to wear masks, hallways, on the field or in cafeteria. So any common areas, everybody has to be masked. Masks also need to be worn when talking or confronting someone that is 1 to 2 meters away from you, or closer than that distance. But in class, when you are seated and you are just listening to the teacher speak, you can remove your mask because there's about a meter distance between the desks in all of the classes. You also have to make sure you're disinfecting your hands. So students that have to disinfect their hands upon arrival in the building and again before they enter their classrooms. And then once they are in the classrooms, they also have to disinfect their desks and their workspace. Can I have my next slide? Can I have my next slide, please? So another precaution that they are taking in schools is obviously social distancing. Between staff and students, it's specifically 2 meters apart that we have to stay. And then between students of your own class, you can stay 1 meter apart. In washrooms, there cannot be more students than there is washrooms in the bathroom. So everyone else that has to go must stay in outside the bathroom. Also for cafeterias, they do remain open for students that stay in the school, high school. Except there's particular seating. There will be no one to either sides of you, and there can be no one directly in front of you. So it's using every other seat. Also, students have to stay with their own classroom groups as much as possible. We try avoiding mixing 2 different classrooms together. So no student can contaminate anyone from the class. This way, if there's an outbreak, it is controlled in a controlled environment, and everyone in the class sent home if there is an outbreak in a classroom. On my next slide, please. So finally, I had the opportunity to interview Mrs. Sonia Perini at the Niagara Catholic District School Board from Ontario. And she told me a little bit about what's going on in Ontario schools and how and what their prevention plan is like. Compared to that of Quebec, there was some differences, like being in Ontario, they have the option to do their courses online instead of going into school. And every 2 weeks, they have the option to come back. Also, the number of students in a class is limited to 15 or less. But in Quebec, at my school particularly, we still have 34 students in a class, so the regular number of students. Also in Ontario, there are different ways of taking your classes. If it's not online, it is you go into school and you can have um, you have one teacher give you all of their courses for the year for 22 days straight, and then you switch to your next class. If not, um, you have to stay with the same teacher all day. And yeah. As for the masks, in Ontario schools, you have to keep your mask on at all times while you're in the building, except for when you leave during recesses. Outdoors, students are allowed to take off their masks, but they're also contained in small bubbles. Um, they have to keep their mask on at their class, which is different from the rules that are in Quebec. Also, the cafeterias in Ontario are closed, so they eat their lunch in their classrooms, and everything that is in their lunchbox, anything they have to throw away, they have to bring home with them, and there's no garbage bins. Everything is contained and thrown away at home. And I want to say a special thanks to Mrs. Sonia Perini for taking the time to tell me about the schools in Ontario. And thank you for listening. I hope you learned a little bit about prevention in Quebec schools.
Fantastic. I'm gonna stop sharing. Thank you so much, Christina. Unfortunately, we can't see you, which is a little bit sad. I'm curious, though, one of the differences, if I understood correctly, was that in Ontario, the classes that they've changed sort of how classes are being given, and that you have one class for 22 days straight, which, if I understood correctly, in Quebec, your so Christina, what I was wondering is, given the fact that in Ontario, they have classes that are 22 days in a row, whether you think you would have a preference. Would you be interested in going and having one class 22 days in a row? Or do you prefer your current regular school classes and all mixed up?
I think I do prefer Quebec's way of taking things. Like, I do like having the same amount of people in my class that I would any other year. Um, the fact that I have 34 students in a class, it's like it makes me feel like it's a little bit more normal, makes everything feel like a little bit more normal at school. And you also, the fact that you have them for all of your classes, it gives you a chance to like get to know everyone throughout the year, which is always, it's always better than I think it would be better than having just the same class for 22 days straight. Plus, you get to, it's a little bit of more of a normal high school experience. So I do like the way Kovac's doing things.
Absolutely. Zoe, what do you think? Would you prefer to have one class for 22 days, get it done with, or do you like the current way your high school has it structured?
Yeah, I agree with Christina. I think it would be a bit draining to just go to school, have a crash course for 22 days of like every subject or like a particular subject, and then just do that for the entire school year. I think, having a sense of normalcy, kind of like how it was before the pandemic, of course, like respecting the necessary safety measures, is a better option in my opinion. But of course, it depends how the government wants to go about it. So, yeah.
Of course. Jasmine, what do you think?
I prefer Ontario's way actually because I just feel like it's safer. Because if you have normal classes, you come into contact with a lot more people, and that I feel like that's just going to spread the virus a lot more. So.
Very interesting. And Athena, you're on mute. What do you think?
I think it depends on the age of what grade you would be in and different things like that. I didn't get to hear the full question or all of Christina's presentation because I was off. So do you mind just maybe explaining a small part of it, please?
Sure. So what Christina said was in Ontario, the classes are so that they're limiting interaction with lots of students. The students get to take the same subject for 22 days straight. Just one subject. So they stay at the same students. And then at the end of the 22 days, they switch to another topic or another subject. So what do you think? What would you like better?
Well, actually, I don't think that is the best idea to have a subject for 22 days. I guess it's going to get a little bit boring doing the same exact subject for those 22 days. So maybe the other way would be better, in my opinion.
Very good. Well, you're up next as well. So we next have Athena Yachofano, who is going to be telling us a little bit about a clinical trial that she did some research on that's taking place here in Montreal.
Okay. Do you mind putting the slides, please?
Sure. Why don't you introduce yourself first, and then I'll put your slides on.
Okay. Hello, everyone. My name is Athena Yachofano. I am currently in Sec 1 at Collège Sainte-Marceline. As part of the Young Women in Bio Club, I chose to talk about the cold corona clinical trial. This trial is being led by Dr. Jean-Claude Tardif from Montreal, Canada. This trial is all about using an existing drug to reduce the inflammation storm your body creates when reacting to COVID-19. I was interested in this topic because it gave me lots of hope in minimizing the complications COVID-19 can cause, ultimately saving lives. Let me explain how the trial works. Would I please be able to have the slides? Thank you. The cold corona clinical trial is attempting to use an existing drug to prevent or control the inflammation storm some people experience when infected with COVID-19. The inflammation storm can occur when the immune system initiates an exaggerated response to the infection. Ordinarily, the body produces enough cytokines to fight off the virus or bacterium and then stop once the invader has been defeated. During an inflammation storm, the immune system goes into overdrive and continues to release the molecules, which then end up attacking the very organs they were intending to protect. The drug the trial is using is colchicine. It's used to treat gout, a type of inflammation mostly in the foot. The researchers are hoping that this drug anti-inflammatory properties can help fight the inflammation storm. As I read the article, I noticed there were no mentioning of the side effects it may cause. After being lucky enough to have interviewed with the head of the trial, Dr. Tardif, stated that there is a risk of nausea, abdominal pain, and or diarrhea. I also wondered how they would measure the inflammatory response to see if the patient has the inflammation in their body. They do not use measures such as taking blood tests or scans. The only way to know if the patient falls very ill, ends up in the hospital, and eventually in the ICU. I was also curious why the patient can't take an anti-inflammatory medication such as Advil rather than colchicine. Turns out they are both targeting different anti-inflammatory mechanisms in our body. The cold corona clinical trial is a randomized double-blind trial, meaning the patient will be randomly given either colchicine or a placebo in a 1-to-1 ratio. Dr. Tardif is aiming to recruit 6,000 patients. The good news is if the result of colchicine is positive, the drug already exists. It can be easily manufactured, and it's not expensive and accessible by all communities. This trial is accessible to many because it's done at home and it's contactless. To be eligible for the study, you must meet the following requirements: positive diagnosis of COVID-19, must be 40 years and over, must not be hospitalized, be willing to take the drug or placebo daily for 30 days, be willing to participate for 2 follow-up calls by phone or video. The Cold Corona clinical trial is currently available in Montreal, New York, New Jersey, Connecticut, California, Madrid, BC, Ontario, and Alberta. I truly hope this trial is successful. COVID-19 has impacted the lives of many people around the world, but no other than the people infected. If this actually works, it can make a huge difference around the world. Being a part of this project was a great life experience, and I would love to do this again. Thank you so much to the Young Women in Bio Club for allowing me to participate in this project. Hope you learned some more interesting facts and enjoy this presentation. Have a nice day. I can't hear. I can't really hear you at the moment.
I'm really
Oh,
sorry.
now I
I
can.
had muted myself. I
Okay.
had wanted to go back to, since you had included something on the mission of YWIB, but maybe let's see if I can get that there. So I wanted to thank you for including that. But yes, this is definitely our mission. And you girls have done, you've been an inspiration to me. You guys have done such a great job. One question I had for you, so I'm going to stop sharing the screen right now, is you mentioned that they're trying to recruit 6,000 people. Do you think that they'll make it?
Well, actually, I discovered last time I checked there were 25.3 million cases of COVID-19. So I would think that if they had that many cases, they could be able to recruit 6,000 patients from the at least around. So
Yeah,
I think yes.
I think that's probably a good guess. I think he's got probably lots of, as you said, there's lots of sites and he's got lots of people working with him. So I'm sure that they will get to it. That was fantastic. Thank you so much, Athena. One thing that I'm not sure that everybody did, and it could be that I'm just, getting older and have already forgotten. Not sure everybody told us the schools that they're associated with. So I figured now would be a good time to go through that. So let's go in the order of the presentations. And if you've already introduced your school, just say it again. Jasmine, do you want to sort of just tell us what grade you're in and or year you're in? Maybe it's not grades anymore in Quebec, and what school you go to.
I'm in secondary 5 at Villa Maria High School.
Fantastic. Zoe, do you want to tell us where you're at?
Yeah, so I'm a Sec 5 at Villa Maria High School also, so graduating student.
Excellent. Congratulations. How about Christina? Where are you at?
I'm a fourth year student at Le Tombe.
Excellent. And Athena, you just mentioned, but why don't you tell us again so we'll complete it?
Okay, I am currently in Sec 1 at Collège Sainte-Marceline.
Fantastic. So our youngest student, so some Sec 5s, a Sec 4, and a Sec 1. You guys have really, I have really enjoyed this. I know this is a lot of work on your summer vacation and now reaching into school, but you guys did excellent presentations, really interesting, very high level. And I know STEM is safe with the four of you. So I want to wish you all, I want to thank you, and I want to thank the people that answered some of your questions. So Dr. Tardif, Mrs. Pirini, Dr. Brazo, and Nurse Tracy Cordero. Is that right? Yes, excellent. So they've been really very helpful. It's been an excellent presentation. I wish you guys a lot of luck with your school year, and thanks very much. And thanks to Tunda. One last thing. Unfortunately, there was one person who helped put this presentation together, the vice chair of Young Women in Bio. She had even more technical problems than I did today, and so was unable to join, but Pascal Bouchard has been very helpful in sort of making sure that we have a really active chapter. So anyway, good luck with the school year, and thanks again so much. Take care.
Thank you so much for involving me in this. Have a nice day.
You too.
Thank you. Bye.
Bye, everybody.